Yeah, so we've just been sorting it out because Jack's computer crashed, and then it was like, it's 9:35, so it's 9:35 now, so we probably would have got about another 5 minutes before we. Yeah, we can do that. Nope, you're fine, David. David. That one there.
A very good morning to you. Thanks very much for joining for our event today. A very important topic of procurement in the NHS, delivered to you, our valued audience, by National Health Executive. A huge welcome to new faces joining for the first time, and hello to those of you who we see every 2 months. The National Health Executive is always keen to deliver content which inspires innovation on the platform long after the event has finished. But before we get started, let's take a moment to pay tribute to Her Majesty the Queen. The Queen held the National Health Service in high regard, and during her long reign made numerous visits to hospitals and opened many medical facilities. She made a massive impact, wanting the best healthcare for people across the nation in the hope they too would live long and healthy lives. Today's event will be packed with opportunities to network and acquire more current sector knowledge. So I hope you're looking forward to what we've got in store. We must thank the industry leaders and experts who have taken time out to join us to share their high quality insights. Due to the standard of content on our NHE365 platform, it's worth me pointing out that all of the content is CPD certified. For every hour of content you watch live, you'll earn 1 CPD point. To receive your certificate, please email the NHE team at marketing@cognitivepublishing.com. That's marketing@cognitivepublishing.com, and they'll sort it out. We also provide the opportunity to give back through some friendly competition. So whilst learning today, our gamification tools will be active. Score points by engaging with the platform's different elements. Join a live session, there's 50 points earned. Make a connection with another delegate on the platform, 100 points. Ask a question in a session or engage with one of our exhibitors in the digital marketplace, another 50. You get the gist. At the end of the event, those who finish in first, second, and third places respectively will have 250, 150, and £100 to donate to a charity of their choice or receive this in Amazon vouchers. You can, of course, only be in with a chance of winning by engaging with all of the great content we have to share with you and the other delegates here, so don't be shy. There's a bit of background. Let's move to the focus of today. In October 2020, a new strategy was commissioned to tackle climate change, and the NHS became the first healthcare system in the world to agree to net zero targets. Developing this strategy came with support from various government departments, including the Department of Business, Energy and Industrial Strategy. Since the announcement, NHS Wales and NHS Scotland have developed a strategy to match the government's target of a carbon-neutral health system. The creation of climate and healthcare units in the US, Canada and Australia also followed suit. The NHS supply chain manages 8 million orders across 94,000 order points in more than 17,500 locations across the UK. As changes are being implemented, the procurement process for NHS supply chains in 2023, this event will be exploring the various changes that will be happening across the industry. We'll be discussing how processes will change for buyers and suppliers, as well as also actually I've lost a little bit of my script there, which is I'll just pick up on paper. Let's just have a look what's happened there. So as changes are being implemented to the procurement process for NHS supply chains in 2023, this event, as I was saying, will be exploring the various changes that will be happening across the industry. We're going to be discussing how those processes will be changing for buyers and suppliers and the impact it will have on integrated care systems. These strategies will all be key themes in our conversations. We also, of course, have great networking opportunities throughout the day, which can be accessed via our speed networking function. Hopefully, some of you may have even tried that early this morning. And I encourage you to collaborate with your colleagues as another source of education. This all plays a part in the community that we're growing to extend the reach and knowledge of those connections shared today, which can be accessed at any time to work within your busy schedules. Also on the NHE365 platform, access to a wealth of information or our on-demand content. alongside the digital marketplace, providing valuable expertise for you and your colleagues to digest at your leisure. Finally, do feel free to share your thoughts today across social media, and don't forget to use the hashtag NHE365. That's NHE365. So with the scene set, let's head into our first keynote of the day with David Williams, Procurement Director at NHS England. David has more than 20 years in commercial and procurement leadership experience. He led the system-wide delivery of the Procurement Target Operating Model Programme, PTOM, to help drive greater collaboration across NHS procurement. And in July this year, led its evolution into the central commercial function, NHS England's new commercial service offer to help maximise value for money for patients and taxpayers. So, David, the floor is yours.
Good morning, Helen, and good morning, everybody. Thank you very much for that, and thank you for inviting me along to the session this morning to open up what will be a really interesting and exciting day. As Helen said, I've been with the NHS for 2.5 years now, and prior to that, I have commercial and procurement experience. But the last 2.5 years have been exhilarating, and I'm very proud to be speaking on behalf of NHS Commercial this morning. If you could just move to the next slide, and I'll just explain what I'm planning to cover over the next 10 to 15 minutes. So as Helen alluded to, I just want to provide a bit of context around NHS Commercial, and then introduce to you the central commercial function, why we've set it up, and what its intentions are. I'll talk a little bit about the work streams and a bit of the detail behind what we're planning to do and what we're planning to try and do together, and some of the benefits that can come from the central commercial function. And then I'll touch on the communication engagement plan and policy that we've got around, which is also important in explaining to people what we're doing and why we're trying to do it. If we could move to the next slide, please. Giving you a moment to digest, I think that the main message of this context slide around NHS Commercial is simply the size and scale of what the procurement and commercial colleagues do across the NHS, the size of the spend that the teams are responsible for, the quantity of spend, of value, of the number of suppliers. I think what it doesn't do at times is to explain the complexity of the NHS commercial environment. And any procurement team that I would meet would talk about the importance of the service they provide to their stakeholders. But in my mind, there's no more critical a service than the service that NHS procurement and commercial are providing to support and improve patient care. So a large cost base that the NHS procurement and commercial teams are responsible for, and an increase, and a very complex one too. So to the next slide, please. The central commercial function. So really, the central commercial function is acknowledging and building on many much quality work that's taken place in the past to try and draw together one central service offering that binds the commercial and procurement community across the NHS. It recognises that in many aspects that there are still some instances where the NHS might be competing with itself, and there might be some areas of silo, but there's been so much considerable progress, and many on the panel and speaking through the day will testify to a lot of the great work that's taken place to bind a procurement community together. But the initiative of the central commercial function, as I say, which was launched back in July of this year to the NHS public board, was to formalise this as a service offering. And it takes two forms, and I'll just start on the right hand side. The central commercial function itself is launching 7 work streams and ways of working to provide that a centralized service that can help to professionalize the operation and make easier for end users, procurement colleagues and suppliers to operate in this environment. And then to the left hand side, the in-year priority projects and sprints is really about demonstrating a need to get started, to get into some deliverables this year, recognizing that the central commercial function will take a year and more to build out and deliver. And you'll see the benefits across the bottom of the slide around creating visibility and value from data, creating a procurement culture that enables collaboration, providing consistency and compliance in the routes to market, so how we buy our goods and services, and then starting to build out those all important supplier relationships and strategic supplier relationships across what is currently an 80,000 supplier base. A couple of points I just want to add to this that aren't on the slide. The importance of and Jackie Rock, the Chief Commercial Officer, has really emphasised and stressed the importance of us co-creating this model. We, as I say, I'm proud and honoured to be able to represent this here. But there's a strong team of procurement experts across the system that have done just a fantastic job over the last years, and we're trying to use our combined experience to create the very best NHS procurement commercial group. Another point is the PTOM, the procurement target operating model. A lot of what that model has evolved into the central commercial function. So that's why you're hearing about this much more as it is evolved into the central commercial function. And the scope of what we're talking about here is commercial in its broadest sense, which includes all of the procurement process, and it includes the supply chain management element, that really important point which physically gets products and services delivered on a day-to-day basis. Okay, if you could pop to the next slide, please. I'm not going to spend too long on this one because I'm going to go around the work streams over the next 7 slides. I'll try not to do too much PowerPointing to you all, but I just wanted to explain and give a picture of the 7 work streams which have been created, have projects against those work streams, and we're starting to co-create them with the procurement colleagues and start some elements of delivery. So don't worry, I'm going to touch on these comments in the next slides. If you can move to the next slide, and I'll work around. So what I'll do with this to help in understanding, I'll just go through the overall message and then give my view, David's view, on a couple of the keywords and the key points that I think are important here on this slide, rather than read everything verbatim. So the commercial best practice workstream is around enabling our community to access tools, expertise and knowledge to deliver activities at every level of the NHS. And to me, that's around clarifying, simplifying the landscape, providing signposting and approvals to how we buy any of these products or services. So it's no small task, but it's how we can navigate and identify how we go about procuring and where someone should go to buy something. And then also to provide a portal, a hub, which is the place, the one-stop shop for anything people want to know about how to do something. So whether it's around contracts, playbooks, anything around the what around procurement, or also about the how. So what's the best way to go about it? So I see those as deliverables, and I see this very much about how we can make things easier and how we can share best practice and bring it into one place. Next slide, please. People and community, the heart of how procurement and commercial works in the NHS, what I'm really passionate about. This is about how we can create a best-in-class learning and development and accreditation environment to support colleagues and to create this commercial culture where people feel empowered, motivated, want to come to work and deliver at their very best. We've started in building out this as a deliverable about talking about how we can attract great colleagues to this industry, how we can develop our colleagues to their very best, and how they wish their careers to develop, and then also how we can retain by demonstrating clear role pathways and an ability to get on in our organisation and learn. And much of the work on the community, which this let's be clear, this has been building over a number of years with lots of very strong alliances, but we strive to do more. We will continue to do more to build that community of support, which shone so strongly through the last couple of years through the COVID pandemic. The next slide, please. That lovely subject of governance, assurance, and process, an important one where there are policies and processes which we are asked to deliver on behalf of the government, of Cabinet Office. And I think I'd describe our role here Well, it describes endorsed, standardized and compliant assured routes. I think a lot of what we need to do here is to make sure that we help the central commercial function helps the NHS to be compliant and identifies ways by which compliance and assurance can be achieved, but we don't stifle, we don't impact on our ability to innovate and to perform and to deliver on those points. So that was the kind of the point I wanted to make here. That could be anything from a PPN, a public procurement notice, to how we manage our commercial standards or the continuous improvement framework or other such policies. So it's around helping and supporting and compliance, but not stifling. The next slide, please. I'm whipping around these. Technology and data, another absolutely fundamental piece for anyone in procurement and commercial. So adopting data and technology that provides NHS with insight into value, savings and opportunities, helping to shape the market, leverage, rationalize where required, and identify where it's appropriate to buy together as well. So the key headlines on this is around are the 2 points on the left, really, which is around around the systems and the technology that we're actively and currently rolling out to provide a better insight for all colleagues on procurement spend, on the pipeline activity, and on contract activity. And then and additionally then talking about the analytics that can go with that. So it's great to have all of the data, but it's then equally important to be able to understand what to do with it and turn it into deliverable action. And I think this is again a very core a core pillar of activity to help drive NHS procurement. Okay, you can see from the pie chart at the top, we're around to, we'll be, if we go to the next slide, we're around to number 5 of 7. So I hope I've still got you. Commercial strategies is a bit of a catch-all actually for this recognition that having a unified and one aligned document, or striving to have one, is important, and it's creating a universal strategy across the NHS for activities. But there are a few parts to that I just want to draw out. There's one that says what is the central commercial functions strategy? So what do we want to, what are our big agents of change? What do we want to deliver this year, next year, the year after, and so on, which is underway. There's another cut of that, which is around the categories by which we are buying, the spend areas. So you could be anything from estates, facilities, transport, digital. What are those category strategies, and how do we develop a clear picture of what we should be trying to do as a system? How do we co-create that? How do we go to market in a sensible, joined up way? It's the second one. And then the third one, and I know it's a theme of the day, is around how we support the emerging ICS, integrated care system landscape, and how procurement and commercial could be ready and fit to do that. And it's been a really interesting topic to understand more over the last year. And I know members of the panels shortly and members of the group later today have all been part of that journey and have all got experiences and stories and learnings to take on that. But the reality is that we need to, as a procurement and commercial community, need to be able to operate and be fit and ready to work to our best in an integrated care system space. Round to the next slide on sustainability and innovation. And as Helen said at the start, the net zero pledge was a real milestone, and hence sustainability being one in its own right a work stream to develop an NHS-wide approach to net zero and social value. And also importantly, having the modern slavery in the supply chain, and that use the word eradicating here in this slide, it's critical importance. And this is an area where we're all learning really, and I think Alexandra Hammond, who is on in the panel later on, will describe the process I hope by which she's brought a group of people together, and we're learning, but we're learning once, and we're learning together, and we're learning quickly. The comment on innovation here is there's a recognition, I think, within the central commercial function that innovation is I'm sorry, there's just a bit of interference. I hope you can still hear me. Innovation is absolutely important across all central commercial functions, and it's a part of our sustainability journey. It will be a part of the whole central commercial function work as well, whether it's innovating around data, around commercial strategies and so on. And then the last of the work streams around sourcing and management, if you could just move on to the next slide, please. This as a quick summary is around how we manage and start to build out our conversations and our relationships with our suppliers in a way that we can innovate, we can drive value, we can build resilience, and we have, as I said at the start, we have 80,000 suppliers. Whether the NHS truly needs 80,000 suppliers to perform its activities is what we need to fully understand. And you'll note as well within this around how we develop and have available a complex transactions team that could support complex and unique procurements as and when they're required. So that's a whistle stop around the work streams that make up the central commercial function. And then my final slide, really just trying to, by way of pulling things together, if you could just move to the next slide, is around engagement and what we're committed to doing with our central commercial function is co-creating, governing and ensuring that we have broad representation across the procurement commercial community, but also explaining as best we can across a number of different mediums and methods, for example today, as to what we're trying to do, why we're trying to do it, the culture and the spirit by which we're trying to approach. And there are some links, and if the slides I'm sure will be made available, is there's a lot of material that we're updating about this online, and there'll be access, and anyone can feel free to get in touch, because it's a big and exciting undertaking for us. Helen, that's it from my side. So I've just taken the scope and the why, run through the central commercial function, the work streams in a little bit of detail, and then try to wrap up with how to get in touch. So thank you very much again.
Thank you very much, David, for that insightful keynote. And you just used the word exciting there. That's exactly the word I was going to use. Exciting word, exciting times ahead for you. Great that you set out the scene. And that leads us seamlessly into our first panel discussion on procurement Trusts. So thank you. If you have any questions you'd like answered by our panelists, then please use the Q&A function and I'll relay some audience questions once we get going. The change in procurement policy has sparked evolution of category management, and the aim is to start in early 2023 and be fully implemented by the end of the same year. The invitation to tender, ITT, published on the 11th of April, invites submissions from businesses who are interested in entering contractual agreements to be part of the CMSP, Category for Management Service Provider, procuring the NHS with goods and services. Businesses who are involved with procurement of goods supplied to the NHS will need to continue improved value and efficiencies for buyers, whilst aiming to become more flexible with their capabilities and, like David was saying, embedding sustainability into their ethos. So, helping us explore this topic, I'm delighted to welcome Simon Walsh, Group Procurement Director at Manchester University NHS Foundation Trust, Tracy Laforte, Group Director of Procurement, Mid and South Essex NHS Foundation Trust, and Dr. Harriet Balding, Research Fellow at King's College London. So, welcome to all of you. Have we got all three of you? Let me put my glasses on. I can't see these. We've got Harriet and we've got Simon there. Have we got Tracy on audio, or is she not there with us? Oh, not sure. Well,
morning, Helen. Morning, Howard. Good morning.
Morning. Do we have Tracy with us, or is it the two of you, do you think? I think it might just be the two of you. So we'll kick off with you, Simon, if we may. A hefty question for you to start with.
Hefty?
A big, thoughtful question to kick off the day. Go on. What do you think has been the impact on the NHS of inflation, the war that's continuing in Ukraine, the supply chain disruption we've seen, and more?
Goodness me, Helen. How do I answer that in a few moments? I think the first thing.
You can rise to the challenge, Simon. I'm confident you can do it.
I think the first thing to say is the all of the NHS, in particular the NHS procurement profession, has responded absolutely magnificently to the immediate challenge to maintaining care and to putting staff and patients first. Behind that, I think we've entered into new territory. Many of us, it's some years since we've worked in an inflationary environment. Some of us go back to the late 80s, early 90s, but it's new territory. And it's forced the NHS procurement profession to refresh its tools in terms of understanding cost and price and breaking down the cost of product and services. Some of those skills have been left a little bit latent over these past years, as we're in a relatively zero inflation environment. The toolkit has had to be dusted off, and those kind of discussions and engagements have had to be had again. And there is an issue there around the skill set within NHS procurement as a whole as to how we respond to that. Massive impact when it comes to supply chain. Obviously, we started off with the impact of EU exit. We then had COVID. We then went to the impact of Ukraine. And now we've seen all the global challenges across the NHS and across the system. And it's forced NHS procurement, particularly NHS trust-based procurement, to absolutely focus on the key things: continuity of supply, business as usual, and being creative and innovative, whilst working with partners such as NHS Supply Chain. So effectively, it smashed some of the things we took for granted, and it's forced us to get back to basics in NHS procurement. And that's what we're doing right across the country, nationally, regionally, and locally.
Yeah, very, very good answer, Simon. Harriet, before we move on, do you want to add any thoughts to what Simon just said there? I saw you nodding away through various things he was saying.
Yeah, I was just thinking that just reflecting on my own experience doing research at a local level in procurement, that innovation can come is so important, and it can come from a lot of different areas. You know, it can come from local teams developing their own ideas, and it's about creating pathways so that they can be heard.
Yeah, it was nice actually, wasn't it? Just to hear David in his opening address saying how he was, wanted to be best in class and wanted to encourage great people into procurement and then retain them. That's all very, very important. Harriet, you come at this from a slightly different angle. You're an academic and you specialize in health systems. Where can academics really add value by looking at an area like procurement?
So I think it's one of those things that is relatively new, a new area for academics to get into, and there's a number of different ways you can come at it, including looking at big data. But my perspective is very much looking at those local interactions. I'm an anthropologist by training. I'm interested in what happens in the everyday. So we know that you can go to a trust and you can ask leaders, how do you do things, and they will give you the policy. But then if you go and spend time day on day on day in departments, you see the hubbub, you see the challenges people face, you start to get a better sense of what's actually going on in reality. And I think once you see that and you have a better understanding of those challenges, and also the way in which people are quite ingenious in overcoming some of those challenges, you can then start to get a different kind of information that can help improve procurement in a trust.
Yeah, well, that leads me on nicely to Simon about how reality compares with perception of NHS procurement. Can you explain that for us? Because Harriet's right, isn't it? There's a perception of procurement, but actually when you get down there at local level and you work with teams, that's when you really see what's going on.
Thanks, Helen. If I could just add, I think we need more Harriets involved in and being interested in NHS procurement. I think as a profession, we have very often distanced ourselves from the academic side of supply chain, logistics, procurement, and we need more interest in that. We need to commission work on NHS procurement. The Healthcare Supply Association, which represents NHS procurement professionals, we want to commission work on NHS procurement. So we need more Harriets, if I can just say that.
Thanks for the shout out.
If you don't mind me saying. In answer to your question, I think it's really interesting how the media portrays NHS procurement. If you look at, for example, and I hate to use the phrase COVID, but if you go back to the COVID era, NHS procurement was part of initially what was seen to be some sense of failure around PPE. but yet at local level, at regional level, at national level, there was a massive collective joint effort to resolve the problem. And I think it's really interesting. Very often the media will portray NHS waste, NHS failing to get value for money. And I know that there are examples of that. But equally, I also know, and I have factual evidence to show, that there is a great quality of NHS buying, which is ingrained into NHS procurement. So I don't think we'll ever get to the position where NHS procurement is elevated to national acclaim. Equally, on a day-to-day basis, we get on with the job and we deliver. And in most cases, people today will walk into NHS hospitals, walk into NHS clinics, get NHS services, and the staff providing those services will have access to the goods, equipment, materials they need. And that ultimately is how I judge how successful we are.
Harriet, when you were talking about being at that local level, I know that having read your background, that's qualitative research, isn't it? When you're watching people making procurement decisions on a day-to-day basis, what can you see when you're looking at that local everyday perspective that perhaps might not be visible when one looks at the NHS as a whole?
So I think I've got an example I really wanted to share there, something you can only really see at a local level. So I was working in a local clinic, and the people that were running this clinic were quite, divorced from the central trust, and nobody was really seeing the challenges they were facing, and they were bringing in people that were sometimes very ill and needed to be sent to hospital. They wanted to purchase a roll of bus tickets so they could put people on the bus and send them straight to hospital. But they had such terrible problems sort of with communications with the central procurement department, and about this is not an item that's readily available through the main system, and sometimes they could get bus tickets and sometimes they couldn't. And on one occasion they just couldn't get it approved, and in the end they had to call somebody an ambulance. So if you compare the cost of a bus ticket to a cost of an ambulance, it really does make that point. And it's so hard to see that when you're sitting many miles away in an office. But if you go and just have a look at what people are facing, and the fact people do come with emergent conditions, and how are they supposed to deal with that responsibly, and people just have to use their imagination, their ingenuity, to just try and find a way to solve that situation. And this was another interesting finding of ours, was this is why people were it was a lot of why people were non-compliant in the directorates that we were looking in, because they didn't have access to the goods that they needed on a particular day for one reason or another. So they get out the credit card, or they put in an expenses claim, they hop on Amazon, because it's about solving that crisis in the moment.
Yeah, gosh, I can imagine you see a lot of that when you're actually at grassroots level. Oh, Tracy's joined us, which is great. Hello, Tracy. Lovely.
Morning. I'm so sorry.
Don't you worry. I looked up and then put my glasses on, having introduced you, and realised you weren't there. But it's all right. Simon and Harriet have kept us going nicely. There was just a question coming in from Mandeep, which I was going to put to you, Simon, if that's okay. Mandeep says, encouraging long-term partnerships. What approach should the NHS take to help support long-term partners with the current unprecedented and unsustainable inflationary cost pressures?
I think we've got to be really flexible. We've got to listen, and we've got to see the facts. We've got to rely upon our suppliers and our contracts to give us that information. They have to be open book with us. They have to share the cost pressures, all the different components of the product and service they provide. And they've really got to take us into their confidence and to show us where those cost pressures are. We're not just going to agree to cost pressures. We're not just going to agree to long-term relationships to mitigate those cost pressures. It's got to be part of an ongoing dialogue, particularly around contract management. And I think that is an area of weakness right across NHS procurement. Very often we're focused upon negotiating the contract, awarding the business, moving on to the next contract. We're not always as good at managing that contract and seeing how that supplier performs and how things develop over the life of the contract. So for me, it's talk, and talk about the issue.
Thank you for that. So I hope that was a good answer, Mandeep. Tracy, David in his keynote was talking about technology and innovation. How is NHS procurement modernising and new technology emerging, and is it coming quickly enough for you?
Good question. So we at MSc, we do have innovation fellows, and we actually actively encourage innovation through applications, etc. And I think the height of it around that patient quality and experience, you saw a lot more come online and on stream because of digital like this in virtual land. So we are seeing that advancement. I would say it's the investment needed in that advancement. In significant sums of money. So that's the thing that needs to follow it, the cash. But we are seeing an awful lot in the patient experience where we've created applications so patients don't have to come into our hospitals, their care virtually. From a procurement experience, we're trying to standardise our practices with technology, and we are trying to do more internet activity with our supplier virtual way based on what we've just experienced in the last 2 years.
Simon, do you want to follow up on that in terms of modernising and using new tech?
Yeah, absolutely agree with what Tracy said. I think we really have to look at the different levers for technology. There's a whole new world out there, and for example, within this trust now, we've got some robotic technology around artificial intelligence within accounts payable and within our procurement team. There's a whole new range of levers and things to do, and we've got to be really open to that. If I could just come back to Harriet's comment about the bus tickets, I mean, that's a really good example.
It is.
It is. We have those kind of scenarios every week. How do we get this? How do we get balloons? How do we get the fish tank repaired? How do we do this? How do we get fast food vouchers for staff who are working overnight? Most NHS procurement teams, I can't say all, but most NHS procurement teams will see that as a challenge to resolve. And that's the kind of approach we should take. Bring it on. How do we sort out the birthday cake and the candles for somebody who's 100 in our hospital? How do we get that sorted? How do we get the candles that don't light up but light up without a flame? Those are the day-to-day things that NHS procurement teams will be involved in, and nobody should have to use their own cash or their own credit card. You know, there's various systems for us to resolve. But really good example from Harriet.
Yeah, it was a very good example. Harriet, going from the birthday candles and the bus ticket to high value items. I know you've done a review of hospital processes for purchasing high value items. What's the main message that you are able to share with our audience from that review?
So I think this is the kind of thing you hear from academics all the time, and I understand it can be irritating, but I think the main point actually is what Simon said, which is it showed there's really not a lot of solid academic research in that area at all. So there were actually very, very few good quality studies. But the ones that we did find, there was a very clear finding that clinicians need to be involved in that process and are often excluded. So that was a persistent theme, that you need to get the perspectives of quite a few different stakeholders when you're making decisions about purchasing high value items. And often I think there can be barriers between procurement teams and hospital management and the clinicians that actually use these products, and indeed the patients as well. There's a lot of different stakeholders that should be consulted when making decisions like that. And that was a recurring theme, really. So there's that I can confidently say, but the main thing is that we need more academic interest in procurement, as Simon said.
Well, before you came on, Tracy, Simon said we need more Harriets within the NHS, which was a lovely
I may be regretting that comment, Helen. I may be regretting it now. Only joke. Only joke.
I thought that was a lovely thing to say.
Only joke.
Again, in our keynote, Tracy, which you may not have heard from David, he was talking about wanting to be best in class in procurement and how to encourage staff into the area of procurement and then retain good people. There are retainment and recruitment issues in so many professions these days. What's the career progression, if you like, within procurement?
Oh, that's a challenging one, isn't it, Simon, at the moment? I think we are really struggling to recruit into procurement, especially NHS procurement. People don't see what that experience is and don't get the feeling of what we have to offer. Personal experience, I started off as a band 4 ward infantry clerk in an organisation, and I worked my way up to the various grades to where I am today. And I actively encourage my own team to so I try and organically grow my own team and encourage them to do their Chartered Institute, Purchasing, Supply, etc. And we've recently started the graduate scheme with procurement skills development team. It's encouraging procurement, the NHS, and or transactional function. We have a lot more to offer, from logistics, from materials management, stock ward infantry, buying, sourcing, contract, commercial. There's so much we have to offer, and it's getting it out there and making it really visible in the public, because recruitment for us, as in many of our professions, is really difficult to get really good people that want to come on board to do this really great vocation.
I know that Simon will want to add to that, because you've been in NHS procurement for, I'm not wanting to date you here, Simon, but 34 years. So clearly it's an area that you've really enjoyed and risen to the various challenges I'm sure you've experienced over those 34 years. What would you say to somebody about coming into procurement and the opportunities it offers?
Thank you. I think there is no other part of the NHS corporate services that offers the range of experience, the range of satisfaction, the range of frustrations at times, but the sheer scope of what we do. Everybody in a hospital, in a healthcare setting, everybody has a requirement for goods, equipment, materials and services. And a really good procurement team has the ambition to manage all those commanding heights of spend. And the range of opportunities, the engagement, the challenges, the satisfaction is absolutely there. And absolutely agree with Tracy. We've now got a national NHS procurement graduate scheme in its second year. For the first time in probably 15 years, we've managed to launch that. I think there's 33, 34 graduates on the scheme. It's really going to hit and attack some of those issues, but locally, within the trust procurement teams and within the regional systems, we have to promote, we have to train, we have to encourage, and we've got to have more visible leaders across the system who are willing to come to conferences, to make comments, to speak, to write articles, engage academia. You know, we've got to lift the profession's profile in order to make it attractive as well.
Harriet, moving back to you, are there any recommendations for good practices that you can share? Any examples from the research that you've done?
Sure. So the thing that struck me the most, and if you take one thing away from the qualitative research that we did, it was listening to those experiences of the people on the ground, because the way they cope with that often directs the innovation that you need to improve those processes. So a small but useful example was, I found almost everywhere I went, people had notebooks, Post-its, things taped on the wall with the product codes of the things that they needed. And I just thought there must be a way of standardizing that, of giving them something more formal, or, you know, improving the procurement software so they could have favorites, you know, that were easy to access. And I can see wry smiles all around, because I understand the challenges of this. But if everybody is doing something to try and improve their working environment and their efficiency, then it does indicate that there's an area for improvement there. And speaking to people directly about how they can be helped can be really, really useful. And it also, I think, would help break down some of the alienation that people can feel sometimes, especially if they're working out in the communities and they're not so close to the main directorate. And the other thing that I wanted to say is most people I spoke with were really desperate to save the NHS money. So they weren't being wasteful on purpose at all. I spoke to one person who said, I always buy things on Amazon rather than through the system because it's cheaper and I want to save the NHS money. And it was sad to hear, because she she didn't, obviously she doesn't understand the ins and outs of the contract management and the issues that might cause, but she genuinely wanted to save money. So just improving communications and getting a better understanding at a local level of how procurement works is something else that I'd like to see.
Does that ring true for you, Simon, and also for you, Tracy, within your NHS trusts?
I think it's really good to get that feedback, and it's certainly similar to feedback I get at times. I think procurement teams are becoming increasingly flexible. We do use Amazon, we do use different routes, but also we are always mindful of the big picture across the trust and the continuity of supply, the continuity of price, the national arrangements which are in place through NHS supply chain. It's very much a balancing act. But I do agree, when I go out, you see people with pieces of paper, even though within this trust we have an electronic ordering system and we have an electronic catalogue. A lot of people find a lot of comfort from a post-it note, and it's surprising how much comfort that gives to people when they're doing the day-to-day job, me included.
Tracy?
Yeah. I'm in sentiment there, having been the person myself. Yeah, I think it is a comfort, but I totally appreciate where somebody feels I want to get good at every level. So we've introduced sprints, we're going back to basics, we're on the ward looking at what we can do to change practices and make their lives a lot easier. We have electronic data, so it's in our teams, but I think some people just papers barrier that.
Yeah, a bit of a comfort blanket, I think. Just a quickie, Harriet. Lisa Richardson says that she's possibly interested in the disconnect between clinicians and procurement for her MBA business investigation in my NHS organisation. I haven't so far found much to base my research on. Could she perhaps reach out to you after this for a conversation and a little bit of guidance? Is that all right if we get Lisa? We'll get the team behind the scenes to connect Lisa Richardson with you, Harriet, if that's okay.
Yes,
And then
she's very welcome. Yeah.
That's kind. Also a question, perhaps for you or Tracy, Simon. Debbie Keating says, we were approached by a GP federation to build a self-referral platform. We did this in collaboration with senior clinicians that has reduced travel into hospitals as patients are triaged via the platform and signposted to the correct clinic and cutting down waiting lists massively. My problem is speaking with other trusts, etc. My question is, how would you recommend suppliers like ourselves actually speaking with relevant decision makers within the trusts? I don't know whether you caught all that because there was a bit of noise. Actually, now it's you, Simon, because Tracy's dropped off again.
I don't blame her. That's a really good question.
Isn't it?
It is a really good question. I think finding the right person in a trust to discuss those kind of things is absolutely key.
Okay.
And certainly the procurement team, I'm a bit old-fashioned on this, but I think we have to act as a shop front. We're a bit of a GP on these matters within the trust. We should know who to talk to, who to recommend people to talk to, how the system works. But I very much believe in the stakeholder gatekeeper role of trust NHS procurement teams. We should know where to guide a potential supplier or a budget holder through the trust process. We should be the people who give that guidance.
I'm going to, Lisa says thank you. She has to dive off the form at 11. Oh, she sent her email. That's fine. Brilliant. Last question to you, Simon, if I may. You delivered an annual £8 million saving programme. You've delivered that since 2009. So that's been ongoing for a long time. Any learnings or advice just in the last minute or so that you can share for other trusts on that front? So we started on a big question for you and we'll end on a massive question too.
Thanks, Alan. We've had to be very, very creative. We've had to use every lever, whether it be inventory reductions, catalogue management, inflation resistance, long-term arrangements, tactical savings, strategic savings. My advice to anyone, and everybody's struggling on savings at the moment, we are struggling on savings, everybody is struggling across the system, national, regional, locally. My advice always is, you've got to attack multiple fronts, you've got to look at multiple lines of attack, and you've got to have quality information. And I think Harriet's right on that issue. you know, the quality of information will feed the quality of the buying, and that's absolutely key. Investment in inventory management, investment in data, investment in catalogue, investment in systems will ultimately give you that better quality command and ultimately those savings and value for money opportunities.
We started on a strong line, we've ended on a strong line, and Harriet, Simon's definitely shared the love for you and your academic learnings. So all good, I'd say, for our first panel. So thank you very much to our first panelist, to Simon, to Tracy for popping in and out, and Harriet for kicking off the day with some great conversation. Thank you to you as well for submitting some questions. We'll take a break now, time to digest what's been covered so far. If you have chance, do engage with the speed networking functionality. Perhaps use what you've learnt as an icebreaker. Let's meet back here in 10 minutes' time.
Thanks, Helen.
Thank you.
Thanks, Harriet. Nice to see you again.
Thank you. And Harriet and Simon, thanks for carrying